Welcome to the office. Pablo, welcome to the office. Nice to meet you. You're here for a couple of things.
Yes.
Right? And we went over a little bit of what's going on with you. Number one is the back.
Right.
And you've had that for several years. You're getting some heel pain in the bottom, and you're getting burning in the middle of the back.
Yes.
Correct? Okay. And is there anything else I need to know?
Not that I could think of at the moment.
Okay. If anything comes up, please share.
Will do.
All right. What we'll do is let's go over your x-rays. I want to kind of explain a few things. There's a lot of cool findings on your x-rays. And then we'll do the exam and figure out where we're going to start.
Got it.
I'll see you for about 3-4 visits, and then we'll make some decisions after that.
All right.
Fair enough? Okay. And the first thing we're going to see is we have quite a few things going on here. Let's zoom in over here on the A to P, and let's see what's going on first in the low back. And we can see there is quite a few things. We can see the way the bony structures are. It almost looks to me like there was nutritional stuff. So were there any other diagnoses growing up as a kid?
Asthma.
Asthma, what else? Any bone issues that you were told?
No, I haven't. I've never been told about the bone issue. Yes. The only thing I have is like the cleft palate,
So you had
the ear problem,
Correct.
and the that was pretty much it. Yeah.
Okay. That's not what I was referring to. What I'm referring to, when I look at your bones, we don't have the smooth bones, right? We have a lot of this jaggediness the way they've developed. And like you can see here, there's an extra bony piece. And that's all okay for right now, okay? Because we're not here to remodel your pelvis in terms of what the smooth curves and stuff.
Right.
We're looking at alignment. And we want to make sure that your alignment is correct. Yes? So we need to address his alignment. We'll go over the numbers. But here are some interesting findings here, okay? When you look here, you can see he's getting a lot of arthritic changes in his spine. Whether you want to call it spondylosis, arthritis, spondylitis, you can see that whatever happened here, there's a kink in the left part going towards the left side. But at the same time, he's getting this flowing exostosis. Have you been tested or ruled out ankylosing spondylitis? Did anyone use that term?
Never. I mean, I remember as a kid, the doctor was checking my spine, but I was saying, it was okay,
Okay, I'm gonna have you do a blood test, okay? And need you to do it. We need to rule something out.
Got it.
And we want to rule out ankylosing spondylitis. It's an inflammatory condition. It's similar to like a rheumatoid type arthritis. Now, the reason I say that, you're having what's called flowing exostosis, where these bones are all fusing with calcium all the way through, and it's more than 3 segments. If I look on the lateral x-ray to confirm it, and we can see the same thing here. It's called a flowing exostosis. So I want to rule out and make sure this is not ankylosing spondylitis. If it is, then this becomes a management issue. There is digestion, there's nutritional stuff that we need to talk about in detail.
Right.
I do see you have some digestion issues going on, so I'm pretty sure there's something hiding in there. The test that we test for with ankylosing spondylitis is we want to do a rheumatoid factor, RF factor, and we want to do HbLA27. If both of those are positive, then there's a strong correlation and possibility of ankylosing spondylitis. Okay? Now, it usually starts as sacroiliitis. It starts off as inflammation in the SI joints, which eventually leads to the SI joints wanting to fuse. Like you can see here, this thing is trying to fuse. So we got to see where the pressure is today. It's really important. If there's fusion in the joint, there's nothing I'm going to do for a fusion. I want to be very clear about that. Okay?
Say that again?
If the joint is fused with calcium,
Right.
that's not my case.
Okay.
Okay? My case is, where's the pressure? Is the foundation level and balanced? And find the pressure and get the pressure off the nerve.
Okay.
Make sense?
Yeah.
Okay. Now, let's look at your numbers. And here are some of the things that we can see. There's a lot of good news here too. The good news is you don't have a big leg length discrepancy, so that's great. We do have something going on in this left SI joint. We have a slight rotated sacrum on the left, and we have a slightly tilted pelvis. So the left side pelvis goes down, PI, and the sacrum on that left side goes back. So there's a little disconnect in that left side.
Is that the reason for the pain on the left side?
Potentially.
Okay.
Potentially, okay? So that's number one. That's number one. If we go over here to this x-ray, let's go to your lateral. Your tailbone looks pretty decent, okay? It's smooth all the way through. I don't see a lot of jagged pieces. There may be something at S1, but we want to get to L5 as soon as we can, because L5 you can see is tilted and it's taking the whole spine back. So L5 is going to be one of our majors. Now, does this make sense, this what I'm showing you here? We have a left SI joint as part of the foundational misalignment. We will figure out if we're starting on sacrum or your pelvis today. Once we can stabilize that, we need to get to your L5.
Okay.
Okay? Now, let's go up the spine and let's see what we got. Yeah, you can see all this flow and exostosis here. And then there's a hard kink from left to right. We have a deviated septum. I may work on your nose for you in one of the visits, okay? Now, let's look at this x-ray and let's look at the overall. So overall, we know there's some alignment issues. Things are compensating and some things are wearing out. But you still have decent discs there. That's the good news, okay? Now, here's another finding. You got all kinds of good stuff. Now, this is C2 and C3 are fusing together. Let me rewind. C3 and C4 in your neck.
Okay.
It's fusing together. We call it the butterfly appearance or the wasp waist deformity. It's not, it just means that these two have fused together.
Right.
Okay. Now what's happening here? 4 is fusing to 5, 5 is fusing to 6. So all this is just kind of wanting to fuse together. And the question is, why is it doing it? That's what we need to figure out.
Okay.
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 Now, if I have to adjust 4, I can probably do something. If so, I hope nothing shows up at 3 because there's nothing I can do for 3.
Okay.
Okay, I just want to be clear about that. Does that make sense?
Mm-hmm.
Okay, so let's put this together. We need to work on your foundation, number 1. Number 2, we need to figure out what's going on in your upper cervical up here.
Okay.
Okay, up top. Whatever's going on in here, this is fused. I don't know that there's anything I'm going to do for this part of your spine. I just want to be clear about it. But the number...
is it stiff on the neck sometimes? Is that the cause, you think?
It's fusing.
Yeah,
That's the calcification.
I'm always having to twist it just to loosen it up sometimes.
Correct. And one of the big things for you is going to be movement and motion. Okay? So you do move a lot, which is great.
Right.
We're going to work on your digestion, number 1, with your foundation.
Got it.
And we'll see you a couple of visits, and then we'll make some decisions.
All right.
Okay?
Yes.
You ready? Listo? Bueno. All right. Let's see what we got, Pablo. Starting at the base of the neck. And it goes back to my saying, it doesn't matter who you are, what you have, everybody has a spine, everybody has a nervous system. When there is interference in the nervous system, the body cannot function at its optimal best. So our job is to check, am I clear? And the first part of the exam is going to be this instrumentation. And the first thing we see, he's going to make my job fun today. All right, senor. C6, C7, base of the neck, left side, 15 points. T5, 8 points, left side. Oh, interesting. We're getting L5. Nice. 10 points. L5, T5, T6, and C7. Those are the 3 spots I'm getting today, okay, sir? Next thing we need to do is let's go ahead and check movement of your pelvis, feet together. Open your knees, close your knees. Bueno. Slide forward a little bit, move forward. There you go. Bas. Feet together. Open and close your knees. Open and close. Good. Right side only. Left side. Pretty decent. There's a little shifting on both sides, but not a lot. Feet together again. Open and close the knees. Right side only. Left side. Yeah, that's not as major. Interesting. Very misleading. Back slowly towards me. S1. Really? Yeah. Right there. Number 5. Yes?
Yes.
2, 3, 4, 5, 6. 6 or 5? More pain, 6 or 5?
6.
7, 6. Okay, this one. 6. Sit back for me, please. Bend to the right, bend to the left. He still has some decent movement at least. 7. Okay, here's my game plan for today. We're going to do C7, T6, L5.
Alright.
After that, I'll have you walk. I need to do work on your shoulders today and your ankles as well.
Got it.
You got it?
Mm-hmm.
Let's do it. Come over here, face down, please. Alright, let's start with L5 today. Let's get a listing on L5. L5, we're going to set it as a PRSM. T6, we're going to set it as a PRS. Still, we can justify it. And C7, we're going to set as a PRS. PRS. The only reason we're doing the dash M on this side is because of the curvature. So we want to be, curvature goes this way. PRS is in the concavity, so we want to be on the opposite mammillary. Okay, like that. I didn't even do nothing, dude. Come on. And then we want to torque it. We want to torque to close the wedge because it's, dude, I haven't even done anything. I'm just demonstrating.
That's time for it.
Yeah. Dude, he's got quick reflexes. Okay?
Mm-hmm.
So we want to lift and torque. Poquito. This guy's quick. Gotcha. Gotcha. Relax the shoulders down, brother. Bueno. Yeah. Deep. 4, 5, 6. PRS. Gotcha. Bueno. PRS. Inferior hand contact. Lift. There you go. That's a piece. Your chin okay there, sir?
Yeah,
Let's go in the chair and get more. Come off slowly, please. Hold my hand. Push. Good. That's good. Let's walk. Walk a line. Keep walking. As you're walking, tell me if anything is different in your low back.
I guess smoother. I'm not feeling that much, I guess pain when I'm walking around.
Little less pain.
Usually I feel it, like on the left side, but
So it's good.
yeah.
Alright. So your back pain got better with an L5 adjustment. Now, let's see if we can get more of the neck. Gotcha. Now, he ain't gonna give me too much time to think about it, so I'll sit up straight. Let's check. C7 is clear. T6 is clear. Doo-doo. L5 is clear. Good. Mira. Better?
Less pain, yes.
Less pain?
Yeah.
10%?
30%?
30%?
Yeah, about 30 more, yeah.
50%? No.
Yeah.
Alright. May I continue, sir?
Yes.
Okay. Shoulders. Shoulder. Let's go on your back. On the black table over here, please. And we're going to do your ankles. Raise your right leg, please. Raise your left leg, please.
Yeah.
There you go. Awesome. Come up slowly, Pablo, and let's have a seat back in the chair.
I'm heavy. Yeah. And
That's not how you get up. Go back up.
yeah, I'm feeling the pain.
What?
I feel the pain when I try to get up on the bed.
So let me show you how to get up.
Okay.
Dr. Gonstead used to say, get up like a cow, not a horse.
Okay.
So horses get up like this on two, just like he was trying.
Okay.
Turn to your side. Turn your body to your side. Turn. Good. Bend your knees a little, just a little bit. Now, you're going to push up, push, and your elbow, and swing your legs down.
Okay.
Push up, push. This is how you get up, especially when you have back pain. Okay? That will save your back. You do that way, it hurts.
Yeah. Back then I used to do it all the time.
Go back down again. Try it again. Should be easier. Turn to your side. Push yourself up. Swing your legs down. Awesome. Stand up. And let's walk it out. And that should be a little bit better now as you're walking.
Yeah.
He's actually walking smoother. Cool. Have a seat over here, sir. Now you get the buff and polish. This is vibration therapy, okay? This is to break up some scar tissue. Alright, sir. Stand up for me, please. Squeeze the hand. Squeeze. Squeeze. Good. Squeeze. Questions for me for today?
About the blood test?
Yes, sooner the better.
Okay.
Okay, I'll have Shesha write it down for you. So we're ruling out ankylosing spondylitis. We're going to do an RF factor and HBLA 27.
Okay.
Okay, if those are positive, then we have to change a little bit of our protocol. Not the adjustment part, but the other stuff we need to work on.
Got it.
Okay, what I will have you start on today, the way I was trained, whether it's rheumatoid arthritis, whether it's Sjogren's, psoriatic arthritis, or ankylosing. A lot of these things were they're defined as inflammatory arthropathies. That's the name that's used. And what they were discovering back in the 1800s, they were treating a lot of these inflammatory conditions by treating the gut, the stomach, digestion.
Okay.
So regardless of whatever's going on, we need to work on the digestion, we can see, and the foundations. Welcome to the office.
Thank you.
You're welcome.